Welcome to the training session on reporting COVID-19 vaccination data on healthcare personnel. This webinar is geared toward long-term care facilities submitting data through the COVID-19 vaccination module of the long-term care facility component. My name is Elizabeth Kyle, and I work with the Division of Healthcare Quality Promotion at CDC. As a reminder, facilities can contact CMS with questions about reporting requirements. Please use the email addresses listed on this slide to contact the appropriate program. The main objectives of today's webinar are to review the foreign changes in the NHSN surveillance definition of being up to date with COVID-19 vaccines. Please note that the foreign changes are now implemented in the NHSN application, beginning with the week of January 1st, 2024. We'll then review example scenarios of how to report data on healthcare personnel working in long-term care facilities. Please note that the slides from last week's webinar are already posted to the NHSN COVID-19 vaccination webpage. We will post updated slides from today's presentation in the coming weeks. Let's start with an overview of how the weekly COVID-19 vaccination data collection form has been simplified for healthcare personnel. I'll now provide some brief background information on form changes. The COVID-19 vaccination reporting form for healthcare personnel has been simplified by removing the question on complete primary series. This reflects the latest guidance from CDC and the FDA. It also allows for us to collect data that are most relevant for public health. In addition, the change enables us to be consistent with CMS quality reporting program measures, since this will now transition to collect data on up-to-date vaccination. The change allows for alignment with the COVID-19 vaccination form for residents. Please note that there are no changes to the resident form. So here's a view of the previous weekly COVID-19 vaccination form compared to the updated form that became available in January of 2024. Let's review the key points for today's presentation. Beginning in January 1st, 2024, up-to-date vaccination is now captured in question 2, formerly question 4, and data on primary vaccination series are no longer collected. Healthcare personnel should not be counted as up-to-date with COVID-19 vaccines until they receive the 2023-24 updated vaccine. NHSN is monitoring data and sending data quality outreach to facilities who are now reporting a higher than expected number of healthcare personnel who are up to date. And finally, questions 3.1 to 3.3 will now refer to healthcare personnel who are not up to date for question 2. So now we'll look more closely at the specific foreign changes. This slide highlights that we are removing the question on the cumulative number of healthcare personnel who received complete primary series which is question number 2. The question on up-to-date vaccination, which was previously question 4, is now moved to question 2. And as mentioned before, this mirrors the data collection form for long-term care residents. Please note that question number 3, the cumulative number of healthcare personnel in question 1 with other conditions, now relates to healthcare personnel who are not up to date with COVID-19 vaccination. In the next few slides, we'll review how to answer questions 1, 2, and 3 on the form. For question 1, facilities should enter the number of healthcare personnel who were eligible to have worked at the facility for at least 1 day during the week of data collection. Please note that the vaccination status for all healthcare personnel reported in question 1 must be reported in either up to date with COVID-19 vaccines, which is question 2, or other conditions, which consist of questions 3.1 to 3.3. Also, the sum of the numbers entered for questions 2 and 3.1 to 3.3 must be equal to the number entered for question 1. If the numbers are not equal, the application will not allow for the data to be saved and will instead generate an error message. Question number 2 asks for facilities to report the cumulative number of healthcare personnel who are up to date with COVID-19 vaccination, and you should only count healthcare personnel who received the 2023-24 updated vaccine. Please note that many healthcare personnel who previously had completed the primary series will not be counted as up to date. Question number 2 does not refer to primary vaccination series anymore, so please note that these data are no longer collected. Facilities are encouraged to use the document titled Understanding Key Terms in Up-to-Date Vaccination to review the definition of up-to-date vaccination by each reporting quarter. Let's discuss data quality outreach for question 2. Facilities should only count healthcare personnel who received the 2023-24 updated COVID-19 vaccine. If you don't have any healthcare personnel who received the updated vaccine, please report 0 for question 2. Also, we observed many facilities are reporting a higher than expected number of healthcare personnel as up to date, beginning with January 1st. If there's over-reporting, the NHSN team will send data quality outreach emails to facilities to request review of the data for question 2. Question number 3 pertains to the number of healthcare personnel in question 1 with other conditions. In other words, these healthcare personnel are not up to date. Previously, the questions recorded why a healthcare worker did not receive primary series vaccination. Now the questions record why a healthcare worker is not up to date. Question 3.1 is defined as not up to date due to having a medical contraindication. Question 3.2 is defined as offered but declined the vaccine required to be up to date. Question 3.3 is having an unknown or other vaccination status. Keep in mind that individuals who are not up to date must be reported in question 3. Individuals having a medical contraindication that prevents them from receiving the vaccine that would make them up to date are reported in question 3.1. Individuals who are offered but declined vaccination that would make them up to date are reported in question 3.2. All other individuals who are not reported in question 2, 3.1, or 3.2 are reported in question 3.3, which is unknown or other COVID-19 vaccination status. We'll now review some instances of individuals who should be included in question 3.1. Individuals are counted in this category if they're medically contraindicated. For example, if they have a severe allergic reaction when receiving a previous COVID-19 vaccine dose, or if they had allergies to any of the ingredients listed in the COVID-19 vaccine. We'll now review some instances of individuals who should be included in question 3.2, offered and declined vaccine. In one example, a facility held a vaccine clinic to offer the 2023-24 updated vaccine. Prior to the clinic, an employee informs the clinic organizer that they do not wish to receive the vaccine. In another example, a newly hired employee was offered the updated COVID-19 vaccine during a new hire health interview. The employee verbally declined the vaccine. We'll now review some examples of individuals who should be included in question 3.3. Individuals can be counted in the category if the facility could not determine an individual's vaccination status. So, for example, a facility is not offering the COVID-19 vaccine and does not have information on an individual's up-to-date status. Another example is if an individual received vaccination outside the facility but did not provide written documentation of vaccination. As a reminder, please note that individuals can self-report in writing that vaccination was received elsewhere or provide documentation of receipt of the vaccine. Documentation should include the date and location of where the vaccine was received and the vaccine type. Individuals who have not yet declined or indicated that they would like to receive the vaccine are also counted in question 3.3. In some cases, individuals are trying to obtain more information about the vaccine. In addition, some individuals may be planning to receive the vaccine, but they may not have had the time to receive this or attend a vaccination clinic. Now let's look at how to report data on healthcare personnel using the updated form. Here's an example using the employee category. Out of the 100 employees reported for the week, we see that 75 of them are up to date with vaccination. 2 employees reported medical contraindications, 10 declined vaccination, while 13 reported unknown or other vaccination status. When you add the numbers that are reported for questions 2 and 3, you see that they add up to the number reported for question 1, which is 100. We'll now review the definition of up-to-date vaccination that is being used for quarter 1 of 2024. The definition of up-to-date vaccination for NHSN surveillance has changed over time. Facilities should use the definitions outlined in the following document linked on the slide for each reporting quarter. This slide lists the various COVID-19 vaccine types. To be considered up to date, an individual should have received a 2023-24 updated COVID-19 vaccine. On September 12, 2023, the updated Pfizer and Moderna vaccines were recommended by CDC for use in the United States. On October 3, 2023, the updated Novavax vaccine was recommended for use. For the current reporting quarter, beginning in January 2024, individuals are considered up to date with their vaccines for the purpose of NHSN surveillance if they received a 2023-24 updated vaccine. This slide presents the information we have discussed in a flowchart format. Facilities can use a flowchart to decide if a healthcare worker is up to date with COVID-19 vaccination. Now let's review a few examples of how to report COVID-19 vaccination status for healthcare personnel. This example focuses on Chloe, who is a healthcare worker. Chloe received 2 doses of the original Moderna primary series in June of 2021. She received a bivalent Moderna vaccine in December 2022 and received a 2023-24 updated COVID-19 vaccine in September 2023. Where do we count Chloe? In this example, we will count Chloe in question number 2 up to date because she received a 2023-24 updated vaccine. For our second example, Mark received a dose of the bivalent Moderna COVID-19 vaccine 5 months ago, but declined all COVID-19 vaccines since then. In this instance, Mark should be counted in question 3.2, decline of vaccine, because he declined to receive the 2023-24 updated COVID-19 vaccine. Kit is a healthcare worker. She refused all previous COVID-19 vaccines, but decided to receive the 2023-24 updated COVID-19 vaccine. Where do we count Kit? Kit should be counted in question number 2, up to date, because she received a 2023-24 updated COVID-19 vaccine. In this scenario, Josh received a dose of the bivalent Pfizer vaccine on August 15, 2023. He's unsure if he'll receive the 2023-24 updated vaccine, but it hasn't been offered yet. Josh should be counted in question 3.3, unknown or other COVID-19 vaccination status, because he has not yet received the 2023-24 updated vaccine, but he has also not declined this. In our final example, Michael reported a medical contraindication, and this prevents him from receiving the 2023-24 updated COVID-19 vaccine. Michael should be counted in question 3.1 because he has a medical contraindication that prevents him from receiving the 2023-24 updated COVID-19 vaccine. Let's briefly review the key points again. For question number 2, only count healthcare personnel who received the 2023-24 updated COVID-19 vaccine. Please note that many healthcare personnel who previously completed their primary series are not counted as up to date. Question number 2 no longer pertains to primary series, and this was removed from the forms, and data are no longer collected. And questions 3.1 to 3.3 now refer to healthcare personnel who are not up to date. We'll now review additional updates and reminders about NHSN data reporting. NHSN previously used data quality assurance alerts. However, these have now been retired. Facilities can now use the resident vaccination line listing report to review weekly RSV and influenza vaccination data submitted by facilities or groups. These data are included in the line list titled Line Listing All COVID-19 Vaccination Cumulative Summary Data for Residents. To find the line list, please go to the COVID-19 Respiratory Pathogen module in the COVID-19 vaccination folder in the Analysis tab within NHSN. As a reminder, if a facility decides to use the person-level vaccination forms, they'll automatically apply the up-to-date definitions for you for Q1 of 2024. CDC encourages facilities to use these forms as they help to manage and organize the reporting of COVID-19 vaccination data. We'll now review how to access the additional resources available to facilities. The long-term care component website contains links to a variety of training materials, including quick reference guides, training slides, and information on CSV file upload. For facilities who use CSV file upload, please note that the CSV files have been updated and remain an option for submitting data. This slide shows where the person-level vaccination resources are located. You'll find several guidance documents along with information about CSV data import. CDC is happy to assist with any questions you may have. Please use NHSN ServiceNow to submit questions. The new portal can be accessed using the link on the slide. This concludes the presentation. Thank you so much for your time.